Hello, I'm Dr. Nirvana Luckraj, and I'm the Chief Medical Officer at Healthdirect. Today, I'm going to be giving you an overview of the after-hours GP helpline that Healthdirect provides across Australia. Healthdirect's role in Australia is to provide trustworthy advice and connection to the right care 24 hours a day. We provide advice to our consumers by helping them look after themselves, finding and connecting them with a service that meets their needs when they contact us, and by providing virtual care options when other options aren't available or accessible. Through our nurse triage helpline and our GP helpline services, we connect consumers to a wide variety of pathways. 56% of callers who intended to visit the emergency department have been safely diverted to lower level care. We also refer callers to our virtual emergency departments, to which we are directly connected in certain states. Urgent care services have also proven a very useful referral care pathway, with us making over 14,000 bookings for New South Wales urgent care clinics in 2024. Over 350,000 general practitioner appointments were made in the last year, and those who are unable to access their own GP are referred to our virtual or after-hours GP helpline services. We also connect our callers to pharmacy, with a large percentage also advised on how to manage their symptoms safely at home. The after-hours GP helpline is available for those callers as a safety net when their regular GP is not available. Eligible callers who call the Healthdirect Nurse Triage helpline are offered a call back from our GP under certain circumstances. The GP then calls back the consumer by video call or audio on a phone within a specified time frame. The GP can offer e-prescriptions and medical certificates when required, and an SMS with a link to the summary of the consultation is sent to the consumer. An upload of this event summary is also sent to the My Health record if consented to by the consumer, and an encounter summary is sent to the consumer's regular GP via secure messaging. Our workforce is made up of over 100 general practitioners who need to meet strict credentialing requirements. These GPs are located in all jurisdictions across Australia and all work remotely. We also provide a fast track to our GP helpline in the after-hours services for certain residential aged care home, and certain trials are being conducted right now in Western New South Wales and across to PHNs. Consumers who call our helpline can choose to have a video consultation with our GPs, and about a quarter of all callers take up this option. This service is provided by the Healthdirect video call service. This page outlines our national model for the GP helpline service. All callers must first be triaged through our Healthdirect Nurse Triage helpline. And if the nurse determines that the caller needs to see a GP within 2 hours or within 24 hours, the nurse will recommend certain appropriate triage options. If eligible, the caller will receive a call back through our GP helpline. The GP will send an SMS to the consumer with a summary of the consultation and offers to upload the summary to My Health record. Continuity of care is a key focus for Healthdirect. At the end of April this year, the GP helpline service transitioned to our own platform and is now fully integrated with My Health record and secure messaging. Patients can consent for their records to be shared either through our pre-consult enrollment form or during the consultation with the GP. Prior to us transitioning to our own platform, only 4% of callers nominated for their consultation record to be uploaded to My Health record, and this is now increased to around 20%. More work is underway to increase this percentage of upload to My Health record to enable more continuity of care. Here we see the service logic for Tasmania. Once the caller has been triaged by the nurse on the Healthdirect helpline, there are a few possible triage outcomes. If she determines that this is a medical emergency, she can directly connect through warm transfer to the emergency services. The nurse may also recommend that the caller go to their nearest emergency department and can also connect to certain virtual emergency departments around the country where that service is available. In Tasmania, emergency dispositions will be directed to 000 where appropriate or to the nearest emergency department. If the triage outcome is to see a GP within 2 hours or within 24 hours, the referral to their own regular GP is recommended where the patient has access to the GP and believes they can see the GP within that day. Else, referral pathways to care at home during their operating hours may be suggested to the Medicare urgent care clinics or private urgent care clinics where appropriate, or to our own after-hours GP helpline where the caller can expect a call back from our GP. Other dispositions reached in the triage could be to see a GP within a week, that's for a routine GP appointment, to see a pharmacist, or is given advice on how they can safely manage their care at home. We stratify the GP callback into 2 tiers. The first is where the clinical safety threshold is within 2 hours. That is, the nurse has determined that the caller needs to speak to a GP within 2 hours. We commit to a 30-minute callback with a clinical safety threshold of within 2 hours. If they have been triaged to see a GP or contact a GP within 24 hours, we have committed the callers to receive a callback within 2 hours from our GP. At Healthdirect, we take clinical governance very seriously, and we have application of a very robust clinical governance framework across all of our clinical services, including the after-hours GP helpline. We operate a rigorous clinical incidents management system, and anybody can provide us feedback. Details on how to provide feedback will be shared with you. There's a strong emphasis on continuity of care, and we see the value of our callers staying in touch and seeking regular care from their regular GP. We provide acute episodic care when their regular GP is unavailable or inaccessible. We also provide rigorous contractual and operational governance of our service providers who provide the workforce that man our helplines. We also oversee service performance through dashboards, conduct regular reviews and call audits, and prescribing audits to ensure prescribing is appropriate. We also conduct regular consumer feedback surveys to ensure that the service we provide is meeting our consumers' needs. The After Hours GP helpline does provide peace of mind for parents, particularly those with sick children who are wondering whether they should go to emergency and seeking reassurance. We provide over 8,000 consultations per month nationally, with the majority of callers being women and mothers of young children. 75% of all those who contact us intending to visit the emergency department are actually diverted to less acute care following interaction with our services. Over 40% of all our consumers are located in rural and remote areas, and 88% of our customers are satisfied with the service that they receive on the After Hours GP helpline service.